Did you know that the carnivore diet can have a direct impact on your blood pressure? For those dealing with hypertension, every dietary decision matters, and this diet has gained attention for promising quick and effective results. But is it really safe? Are the benefits as clear as they're made out to be? In this video, we'll hear from doctors and experts as they analyze the pros and cons of this diet for those looking to manage high blood pressure. If you're searching for answers about how diet can influence your cardiovascular health, don't miss this. Stay until the end to find out if the carnivore diet could be the solution you've been waiting for. The carnivore diet is a dietary approach that excludes all plant-based foods, focusing solely on consuming meat, fish, and other animal-derived products. The central premise of this diet is that carbohydrates, particularly refined ones, are the main culprits behind various health conditions, including cardiovascular diseases and hypertension. By eliminating these foods, it's believed the body can reduce inflammation and improve metabolic response. On the other hand, hypertension, or high blood pressure, is a common condition affecting millions of people worldwide. It's a leading risk factor for heart disease, stroke, and kidney failure. The relationship between diet and blood pressure management is widely discussed, but can the carnivore diet truly have a positive effect? Let's delve deeper into this topic. As the popularity of the carnivore diet grows, many questions arise about how it may influence blood pressure, especially in individuals with hypertension. Let's explore some of the most common concerns. Can the carnivore diet actually lower blood pressure? The answer to this question is complex. In some cases, low-carb diets, like the carnivore diet, may help reduce blood pressure, particularly if they result in weight loss. This happens because the body begins processing food differently, which can reduce fluid retention and improve glycemic control. However, this effect is not guaranteed for everyone, and the impact can vary from person to person. What are the risks of this diet for individuals with hypertension? While there may be short-term benefits, the carnivore diet also carries risk. Excessive saturated fat intake can lead to increased LDL cholesterol levels, which in turn can worsen cardiovascular problems. Additionally, the lack of essential nutrients from plant-based foods can cause nutritional imbalance, affecting overall health, including kidney function. Is it safe to adopt the carnivore diet without medical supervision? It is not recommended to follow the carnivore diet without guidance from a doctor or nutritionist. Drastic dietary changes can disrupt electrolyte balance and blood pressure, which may be risky for individuals with hypertension. What are the latest studies on the carnivore diet and hypertension? Research on the carnivore diet is still limited, but some studies suggest it may have positive effects for those with metabolic syndrome. However, there is no consensus yet on its safety and effectiveness for long-term blood pressure control. When it comes to extreme diets like the carnivore diet, doctors have mixed opinions. Some specialists believe it may offer cardiovascular health benefits and aid in blood pressure control, while others point out the risks associated with a restrictive and unbalanced diet. Cardiologists, for the most part, express concerns about the impact of a high saturated fat diet on cardiovascular risk. Renowned cardiologist Dr. João Silva states that, in many cases, the carnivore diet may lead to a temporary reduction in blood pressure due to initial weight loss and decreased fluid retention. However, he warns that over the long term, increased LDL cholesterol level and potential negative effects on blood vessels could elevate the risk of heart disease, such as heart attack and stroke. The positive effect seen in some people with hypertension may be temporary, says Dr. Silva. The carnivore diet might lead to an initial drop in blood pressure, but the risks of rising LDL cholesterol and arterial damage could become a long-term issue. Nutritionists, on the other hand, generally take a more cautious stance on the carnivore diet. Functional nutritionist Dr. Marta Rodriguez highlights that completely eliminating plant-based foods can lead to nutrient deficiencies, affecting long-term health. The lack of fiber, vitamins, and essential minerals like potassium and magnesium, for instance, could increase the risk of heart complications and even raise blood pressure. In the short term, improvements in blood pressure may be observed due to weight loss and better glycemic control, but the carnivore diet is not balanced enough to maintain optimal health in the long run, warns Dr. Rodriguez. She also emphasizes that a lack of control over processed meat consumption and high saturated fat intake can be harmful to cardiovascular health. While anecdotal reports of benefits are common in carnivore diet community, scientific research on its long-term effects is still in its early stages. Nevertheless, some studies shed light on the diet's impact on blood pressure, the influence of carbohydrates on blood pressure. A study conducted by Dr. Andrew Smith, an expert in metabolic medicine, suggests that low-carb diets, such as the carnivore diet, may positively impact blood pressure reduction. The study involved a group of participants with hypertension who followed a strict carnivore diet for 3 months. The results showed a significant decrease in blood pressure among several participants, primarily due to weight loss and an increase in ketone production, which has anti-inflammatory effects. The risk of cholesterol increase and cardiovascular issues. However, other studies warn of potential long-term risk. Research from Harvard University indicated that diets extremely high in protein and saturated fats could raise LDL cholesterol levels, a risk factor for heart disease. The study revealed that while some individuals experienced temporary improvements in blood pressure, in the long term, the carnivore diet could contribute to artery stiffening and increase the risk of heart attack and stroke. Effects on patients with metabolic syndrome. On the other hand, a more recent study published in the Journal of Clinical Nutrition found evidence that low-carb diets, such as the carnivore diet, might be beneficial for patients with metabolic syndrome, who are often more prone to developing hypertension. Reduction in body fat, better glucose control, and decreased insulin resistance contributed to improved cardiovascular health in the participants. Despite some short-term benefits, most experts agree that the carnivore diet should not be adopted without medical supervision. Dr. Silva and Dr. Rodriguez emphasize that if you have hypertension or any other cardiac condition, it is crucial to consult a doctor or nutritionist before making such drastic dietary changes. The carnivore diet may have a positive impact for some, but the associated risks to cardiovascular and metabolic health should not be overlooked, concludes Dr. Silva. While it might be a valid option for some, professional guidance is critical to ensure the diet is done in a balanced and safe manner. The carnivore diet has gained popularity, but like any radical dietary approach, it comes with pros and cons. Next, we'll explore the key benefits and risks highlighted by doctors so you can have a balanced perspective on this diet, especially if you already have hypertension. Benefits of the carnivore diet for blood pressure, weight loss, and glycemic control. One of the most notable benefits of the carnivore diet is weight loss. By eliminating carbohydrates, the diet helps many people reduce calorie intake without strict portion control. Reducing body weight can directly impact lowering blood pressure. Additionally, this diet may improve glucose and insulin control, which can benefit those with insulin resistance. A common factor in individuals with hypertension, reduced fluid retention. By cutting out carbs, the carnivore diet may reduce fluid retention, often a cause of increased blood pressure. This occurs because carbohydrates make the body retain more sodium and water. Without them, the body tends to eliminate excess fluid, which can help control blood pressure. Anti-inflammatory effects. The carnivore diet may have an anti-inflammatory effect due to the high intake of proteins and healthy fats, like those found in quality meats. Chronic inflammation is one of the main contributors to elevated blood pressure, and reducing it can indeed improve cardiovascular health. Improved metabolic function. For some individuals, the carnivore diet can enhance metabolism. This is particularly important for people with metabolic syndrome who are more prone to heart disease. Losing visceral fat and normalizing cholesterol levels may contribute to more stable blood pressure. Risks of the carnivore diet for blood pressure and overall health. Increased LDL cholesterol. Although cholesterol management is not directly related to hypertension, the increase in LDL, bad cholesterol caused by the carnivore diet can raise the risk of heart disease. Dr. João Silva, a cardiologist, points out that high-fat diets, like the carnivore diet, can elevate LDL levels, increasing the likelihood of fatty plaques building up in arteries, which can lead to blockages and narrowed blood vessels. Nutritional deficiency. Excluding all plant-based foods can result in significant nutritional deficiency. The lack of fiber, vitamins, and minerals found in fruits, vegetables, and grains can harm digestive health and disrupt the body's nutrient balance. This includes deficiencies in potassium and magnesium, essential minerals for blood pressure control and proper heart function, dehydration, and electrolyte imbalance. Another potential risk of the carnivore diet is dehydration. Cutting carbohydrates can reduce the body's ability to retain water and sodium, potentially leading to dehydration, especially in those with high blood pressure. Electrolyte imbalances can also affect the heart, increasing the risk of arrhythmias and other cardiac issues. Kidney strain. High protein intake can put pressure on the kidney. This is particularly risky for individuals with a history of kidney problems or those predisposed to kidney disease, as they may struggle with the increased excretion of metabolic waste due to high animal protein consumption. For those with hypertension, the kidneys are already under added stress, and a high-protein diet may further impair kidney function. Most experts agree that while the carnivore diet may offer benefits for some individuals, especially in the short term, it should be approached with caution. Medical supervision is essential to ensure long-term effects are properly monitored. Consultation with a doctor or nutritionist. Before adopting a carnivore diet, it is crucial to consult a specialist, particularly if you have hypertension or other cardiac conditions. Medical guidance allows for adjustments to the diet to reduce the risk of adverse effects. Monitoring blood pressure. For those who decide to follow the carnivore diet, regularly monitoring blood pressure is critical. If blood pressure rises significantly, the diet should be reassessed, and alternative treatment options may be necessary. Balanced food intake. While the carnivore diet is restrictive, doctors recommend ensuring balance, choosing lean meats, avoiding excessive consumption of processed meats, and ensuring the intake of essential nutrients like omega-3s, vitamins, and minerals can help mitigate risks associated with this diet. In summary, the carnivore diet may offer benefits for some people, especially in short-term blood pressure control, but it is not a universal solution. The associated risks, such as increased LDL cholesterol, dehydration, and nutritional deficiencies, should not be ignored. For those with hypertension, it is crucial to follow a personalized meal plan under the supervision of a doctor or nutritionist. If you are considering adopting the carnivore diet, it is essential to do so safely, especially if you already have hypertension. Next, we'll share strategies to help you reap the benefits of this diet while minimizing potential health risks, with a particular focus on blood pressure management. Consult a doctor or nutritionist. Before making any drastic changes to your diet, the first step is to consult a doctor or nutritionist. A specialist can help assess your health condition, adjust the diet according to your specific needs, and ensure you're not missing out on essential nutrients. This is especially important for people with hypertension, who need medical supervision to monitor cardiovascular health. I always recommend that people looking to adopt more restrictive diets, such as the carnivore diet, do so under professional guidance, says Dr. Marta Rodriguez, a functional nutritionist. Every body reacts differently, and it's important to ensure you're not putting your health at risk. Transient. Gradually. Switching to the carnivore diet should be done gradually, especially for those with hypertension. This helps the body adapt to the new eating regime without causing stress spikes or imbalances in blood pressure level. Instead of eliminating all plant-based foods at once, start by gradually reducing your carb intake and introducing more sources of animal protein. Additionally, it's important to monitor any changes in your body, such as excessive fatigue, sleep disturbances, or increased blood pressure, and adjust the diet as needed. Maintain nutritional balance. Although the carnivore diet focuses on animal-based foods, it's essential to ensure it remains nutritionally balanced. This means choosing lean and fatty meats in moderation to avoid an overload of saturated fats, which can raise LDL cholesterol. Also, include omega-3 rich foods like fatty fish, salmon, sardines, to promote cardiovascular health and reduce inflammation. Eating organ meats is highly recommended, as they are nutrient-dense sources of essentials like vitamins A, B12, iron, and zinc, nutrients that may be lacking in the carnivore diet. Liver and heart are examples of nutrient-rich organs that can balance the diet. Monitor blood pressure regularly. If you have hypertension, regular blood pressure monitoring is crucial. The carnivore diet can affect individuals differently, and blood pressure may vary based on the type of meat consumed, sodium intake, and the diet's impact on fluid retention. Using a home blood pressure monitor can be a helpful tool to track these changes consistently and avoid surprises. If you notice significant increases in blood pressure, consult a doctor to adjust the diet or explore alternatives to manage hypertension. Stay hydrated and supplement minerals. The carnivore diet may cause dehydration, especially in the beginning, due to carb elimination and increased water excretion. Therefore, it's essential to maintain proper hydration by drinking plenty of water throughout the day. Additionally, supplementing with minerals may be necessary to compensate for the lack of potassium, magnesium, and other nutrients vital for cardiovascular health. Dr. Marta Rodriguez suggests potassium and magnesium supplements, especially if the diet isn't balanced enough to meet these needs. Avoid processed meats and excess saturated fats. While the carnivore diet permits meat consumption, it's important to avoid excessive processed meats like sausages, bacon, and cured meat, which often contain high levels of sodium and preservative. These can increase fluid retention and raise blood pressure. Opt for fresh, high-quality meats like lean beef, chicken, fish, and eggs for a healthier choice. Also, when consuming fats, prefer monounsaturated and polyunsaturated fats found in lean meats, olive oil, and avocados, instead of focusing on saturated fats from fattier meats. Watch for signs of nutritional deficiency. Although the carnivore diet is rich in proteins and fats, the lack of vegetables can lead to deficiencies in vitamins and minerals like vitamin C, fiber, and folate. Pay attention to signs of deficiency, such as excessive fatigue, digestive issues, and skin changes. One solution is to consider introducing small portions of low-carb vegetables like kale, spinach, and cucumber, if allowed within the carnivore diet parameter, or even evaluate vitamin supplementation to ensure your body receives all necessary nutrients. Think about the long term. While the carnivore diet may deliver initial benefit, it's crucial to remember that its long-term impact on cardiovascular health is still not fully understood. Doctors recommend that those adopting this regime undergo regular checkups to monitor cardiovascular health, cholesterol levels, and kidney function. A balanced approach that combines the carnivore diet with other healthy practices, like regular physical exercise and stress management, may be more effective for blood pressure control and overall health. Consider alternatives to a pure carnivore diet. While the carnivore diet is a viable option for some, it's important to remember there are other dietary approaches that can be equally effective for managing blood pressure. Diets like DASH, dietary approaches to stop hypertension, which includes a variety of nutrient-rich foods, and the Mediterranean diet, which prioritizes healthy fats and fresh foods, may be more balanced in the long term. These diets have proven effective in controlling hypertension and promoting heart health without the nutritional deficiency risks the carnivore diet might bring. Additionally, they may be more sustainable, making it easier to stick to a healthy lifestyle in the future. Balance is key to success. Ultimately, the key to a successful diet, whether carnivore or otherwise, is balance. It's not just about eliminating certain foods, but ensuring you're providing your body with the essential nutrients it needs to function optimally. The carnivore diet may be an interesting choice for those seeking quick results, like weight loss or glucose control, but it's crucial to remember that long-term health depends on a balanced and varied diet. Implementing strategies such as constant medical supervision, hydration, moderation in saturated fats, and attention to body signals can help maximize the benefits of this diet while minimizing health risks, especially for those with hypertension. In our analysis of the carnivore diet and its impact on blood pressure, we've seen that while there are potential benefits for managing hypertension, it's essential to approach this diet cautiously. Experts point out that while the diet may aid in weight reduction and inflammation reduction, Its effect on blood pressure can vary from person to person, and constant medical supervision is vital to monitor any adverse effects. Real-life cases show that many people experience significant improvements in blood pressure when adopting the carnivore diet, but they also highlight the importance of continuous adjustments and nutritional balance, especially regarding saturated fats, essential minerals, and the risk of nutritional deficiency. Therefore, if you have hypertension and are considering the carnivore diet, the most important thing is to do so in an informed and supervised manner. With proper care, this diet can be a viable option to improve your cardiovascular health, but always with the guidance of a doctor or nutritionist. Monitoring results, adjusting food choices as necessary, and prioritizing food quality are crucial steps to ensure safety and effectiveness in managing blood pressure. If you found this video helpful, don't forget to leave a like and subscribe to the channel for more content on health and nutrition. If you have any questions or want to share your experience with the carnivore diet, leave a comment below. And, of course, always consult a healthcare professional before making changes to your diet. See you in the next video.